Hello, my name is Jessica Gaviria and I work for Community Links, part of the Catch-22 group. In this short video, I want to explain how you, as a GP practice administrator, can help increase the number of people that participate in the bowel cancer screening. The national average for participation in the bowel screening is 60%, but in London the average is only 55%. This needs to increase. As you may be aware, the bowel screening program is a national program aimed at identifying bowel cancer early. Bowel cancer, also known as colorectal cancer, is the fourth most common cancer in the UK, and the earlier it is detected, the better the outcome is likely to be. There are 16 to 18% less deaths from bowel cancer as a direct result of the screening program. Men are slightly more likely than women to be diagnosed with bowel cancer, but they are less likely to participate in the screening program. Until recently, the bowel screening was available to everyone aged between 60 and 74, and the age limit is reducing to 56 years from May 2021. There are plans to lower this eligibility age to 50 in the near future. The test is undertaken every 2 years. To participate in the bowel screening, patients receive a kit called the FIT kit in the post from the London Screening Hub. Patients will automatically receive this bowel screening kit within 4 weeks of their first eligible birthday, and it includes instructions and illustrations on how to take a stool sample. The patient takes one sample and returns this to the screening hub. The FIT kit replaces the old FOB test, which required 3 samples of stools. We know that some groups of people have lower participations in the bowel screening. Reasons why vary, but it includes cultural beliefs, ethnicity, caring responsibilities, and a lack of understanding in the value of screening, as well as socioeconomic status. GP practice staff are central to helping us increase the participation in the bowel screening. By noting when patients are due for their screen and checking with the patients if they have completed this. As a practice staff member, you might also raise the bowel screening conversation when you're speaking to patients about a different issue. Or you may decide to phone the patient when you notice that their screen is due or if it's overdue. To give you a guideline of how you may structure your conversation with the patient, ring the patient and ask for them using their full name. Introduce yourself and tell them which practice you're calling from. Explain that this is a courtesy call to let them know that the NHS will send them a bowel screening kit within 4 weeks of their 56th birthday, and it will arrive to their address. Ensure that the address is correct in your system and change if necessary. Ask the patient if they have heard of the bowel screening and explain to them what the bowel screening kit is. You may wish to tell them that the kit looks for hidden traces of blood in the stool. Explain that the test is a new one and is easier to complete and may be different to what their friends and families have had in the past. The kit has a prepaid envelope and it's easy for them to return the sample. 2 weeks after the kit is completed, the results will arrive in the post to their home. Throughout the conversation, ensure that you ask the patient if they have any questions and address these questions if they have any. Ensure the patient actually knows what the test entails. Additionally, some patients may receive a further invitation to see a bowel specialist. It's important that these patients attend those appointments because it's very important for their well-being. Mention the key bowel cancer symptoms and ask the patients to speak to the GP if they experience any of these. For example, blood in the stool, changes in the normal bowel habits lasting for more than 3 weeks, any pain in the abdomen area, a lump in the stomach, diarrhea, constipation, feeling tired all of the time, or losing weight unexpectedly. These symptoms should trigger a patient to speak to their GP. Lastly, tell the patient that if they do not get the kit within 8 weeks of their 56th birthday, they should call the Bowel Screening Hub and provide the number for them to do so. Here we have a list of very useful contacts and further websites for you to visit if you wish to get any more information. Thank you so much for listening.